Um, the meeting is being recorded. It's good to know. My name is Eric Strauss. I'm the director at the Department of Corrections, vice chair of this particular subcommittee. I'm happy to have everyone together this afternoon to talk about barriers. I think first off, we're just going to do a roll call / introduction. So, Aaron, if you want to take that away, that'd be great.
Erin, I think you're muted.
Thank you, Lisa. Sorry. I was saying we are trying to get everybody in as panelists as quickly as we can find you. So committee members, if you aren't a panelist yet, please raise your hand and then accept the invitation to be promoted to a panelist. Thank you. Okay. And so I'll go ahead and go down the list, and if you could just say you're here, and then just say hello and who you represent, and if you want to say anything about yourself, that'd be great. So Eric Strauss.
Yeah, thanks, Aaron. Eric Strauss, director for the Department of Corrections. I have a lot of interest in the barrier stuff, so I'll be curious to have a conversation with all of you about it.
Okay, Representative Seckinger.
Hey, yeah, Josh Seckinger, state rep from the west side of Bozeman, and definitely interested in this topic amongst this licensure group. Thanks.
Great. How about Director Brereton? Did you make it on?
Hey, good afternoon. Charlie Brereton, Director of the Montana Department of Public Health and Human Services, or DPHHS.
Okay. Webb Brown.
Hi, Webb Brown, Executive Director, Montana Dental Association. We just had the Board of Dentistry meeting this morning, actually. So looking forward. Thanks.
Great, thank you. Senator Harvey.
Hello, everyone. Senator Derek Harvey from Butte. Looking forward to the discussion.
Jennifer Hensley.
Hi, Jen Hensley here, representing a variety of different licensed occupation, mostly in healthcare, and looking forward to the conversation.
Thank you. Troy Jensen.
Hi guys, Troy Jensen from Sydney, and I'm representing the Board of Professional Engineers and Professional Land Surveyors.
Thank you. Alan Lloyd.
Good afternoon, Alan Lloyd with the, excuse me, Montana Society of CPAs.
Thank you. Krista McCauley.
Good afternoon. I'm a rural nurse practitioner and a psychiatric provider, and I've been working in the county detention centers, so where mental health and recidivism all kind of interconnects, and I serve on the Board of Nursing.
Thank you. Amy Narrison.
Hi there, Amy Narrison. I represent American Medical Response, which provides ambulance services throughout Gallatin and Yellowstone counties, and then also the Montana Psychiatry Association.
Great, thank you. Senator Noland.
Senator Mark Nolan from Greater Flathead Valley, representing Senate District number 6.
Thank you. Allison Paul.
Good afternoon. I'm Allison Paul. I'm the Executive Director of the Montana Legal Services Association. We are a statewide organization that represents low-income people in civil matters, and I am here to represent that population.
Thank you. Jason Small.
Yes, Jason Small, Executive Secretary of the Montana AFL-CIO.
Thank you. I missed somebody. Tony King.
Good afternoon, Tony King. I am a pharmacist representing the Montana Pharmacy Association, but have previously served on the Montana Board of Pharmacy.
Wonderful. Senator Zolnikoff.
Daniel Zolnikov. I'm in the state senate, entering my 7th session this time around. So And this is probably my favorite topic. So looking forward to this one. Thanks.
Great, thank you. Was she able to get on? Brad Longcake?
Hi, everybody. Brad Longcake here on behalf of the Montana Funeral Directors, as well as the Montana Dental Hygienists Association.
Great. And then Stacy, did you get on?
I
tried
did.
Okay. Oh, I don't see you on the list. Okay. Oh, there you are.
Yep.
Oh,
So
okay.
Stacy Anderson, I work with the Montana Primary Care Association that employs a lot of the licenses regulated under Title 37, and we find a lot of the barriers. So happy to join this group and have this conversation.
Great. We are missing just a couple committee members. If they join, I will shoot them into the room and then they can introduce themselves. But we'll do staff introductions next, and then Chair Strauss, you can go ahead and continue on with the agenda. I'm Erin Sullivan. I am the policy analyst with the legal division here at the Department of Labor and Industry. I will be your committee staffer along with the other subcommittees. So you all have been on at least one other subcommittee, and so you've already met me, but happy to work on this topic with you all. We also have Quinlan O'Connor, who can turn his camera on and introduce you as your legal counsel for this committee.
I keep trying to get out of that, but worth a shot. I'm Quinlan O'Connor. I'm the Chief Legal Officer for the Department of Labor and Industry. Happy to provide whatever legal supports you all may need, either here or follow up with you after the fact.
Thank you. And then, as always, we have Lisa Patzer online.
Hi, everyone. It's nice to be here. Thank you.
Thank you. And so we are your trustee staff. So with that, we are done with roll call.
Great. Thanks, Aaron. Appreciate it. I think moving along in the agenda then, and I think the bulk of this meeting will be primarily focused on generating a list of subcommittee ideas about areas of interest in around barriers. And if and when we need to review the appropriateness of those recommendations with the executive order, we can do that as we go. And then ultimately, we want to identify our top priorities for helping staff identify people that they can bring in and talk to us about what we believe are important issues, and then decide how we want to move forward with potentially addressing them. So having said that, I think we just open up the floor here initially to hear ideas from the members of the committee on potential areas of interest that they may want to explore regarding specifically barriers to licensure. So having said that, I would certainly welcome any hand raises or otherwise to jump into the conversation. And not everybody at once, please. Looks like Kristen has one to offer right away. Thanks.
You bet. You bet. This is Kristen McCauley. When I work in the detention setting, some of them are Department of Corrections, and some of them are just waiting to get their new charges. I think there's significant barriers to licensure because of the considerable history of substance addiction that put them in that setting, and then also mental health, severe mental health that they all have, many have in that setting. And when we look at them re-entering and getting employment, they have that felony part, and that holds them back, that they have to identify that they've had these charges or have some issues with entering the licensing part of that. But the other part is maybe they do pretty well in the detention setting with routines and schedules and medications and a routine around that. And then when they kind of are entering the workforce and keeping them licensed, sometimes there's issues with maintaining that structure and maintaining medications and maintaining access to a reliable relationship with a provider. They often lose their provider while they're in the incarcerated setting, and then they're tasked with finding out how to get that all done in the next setting. Whereas if that was done before they left the setting, that they would have that connection with someone that can help bridge them into and keep them going and keep their mind straight and help them connect with resources like intensive outpatient psychotherapy through telehealth if it's paid for, and problem solving, just the overwhelming things, because I have someone that they can trust on, like, okay, we can connect you with this job service. We can connect you with this licensing source. Or how do we problem solve the fact that you don't have a phone, or maybe you have conditions that don't allow you to have a phone, and that makes some problems with workforce.
I would entertain any comments related to that, or I would certainly support a review of some of those barriers that relates to those with previous felony records. I think I mentioned in the kickoff meeting an interest of ours related primarily to stigma. I think most, if not all, license types, there is a pathway for people with previous felony records to get licensure, but there's certainly a stigma and perhaps some undue review of those events as it relates to granting a license. Any other comments about that particular item? I assume, Aaron, someone's taking notes on these as they're discussed. Not seeing any hands raised. Maybe a different barrier that people are interested in understanding more about. Stacy.
Hi, Eric. Yeah, Stacy Anderson. Again, work with a number of health centers that serve 125,000 Montanans with their healthcare. And some of the barriers we routinely run into kind of fall into two categories. One is when the state licensing requirements exceed national licensing requirements. And so are there examples where, like, the example I know the most and most recently have been working on for a number of years is that Montana is the only state that requires gambling hours for licensed addiction counselors. That is a barrier for anyone we're recruiting from out of the state. So that's just an example of that. There might be others, but I think some sort of assessment of that, where we're really cognizant of what's the justification for our standards being higher than national standards. And then the other one is a little bit more difficult for me to articulate. So clinical laboratory scientists have national standards for national certification, but Montana is only one of 10 states that requires state certification. So we have individuals coming in from out of state who are coming from states that don't require state certification. And just in my preliminary look at it, the other states have looked at it and said it is the employer's responsibility whether they want to require the national certification. That was a bill that was passed in '93. I haven't looked up the legislative history, but what's the justification for us being only one of 10 states requiring a state certification when there are national certification standards that an employer could adhere to? Just something to think. There might be others out there, but those are the two that have come up in the last week.
Great, thanks. Senator Zolnikoff.
Sorry, can I interrupt real quick?
Oh, yep.
Sorry, Stacy, you said clinical lab. What was the other one?
Licensed addiction counselors. And I was trying to find it actually just now in the ARMS for Board of Behavioral Health. And weirdly, I'm not finding the LAC section, but I literally am trying to do it right now. So
that's okay. Thank you.
But we've reduced the hours for gambling training, but it's still there. There's still a requirement. I mean, Nevada doesn't even require gambling hours because it's considered a process disorder. So you already can do process disorder training and it should fall under that. But we pull that out and say it has to be gambling specific, which is very, very unique to Montana.
Senator Zolnikoff.
All right. Thank you again. I would say one of them, I think we tried to look at this session, but obviously people were working on this already, so a little late to the game, was geographical barriers. If I want a doctor from the state I came from and want to keep using them, they have to go through a process to get licensed here, but they're licensed in their state. How do we I think Florida did it and we did it during COVID you can basically use whoever you want and they were suspended. Is there a way to allow for that? And again, that's a little bit, I've heard these things, is not my expertise. The next one was there's some old licenses requirements, like for accountants, there's an extra form you got to file for the state that was maybe necessary 60 years ago, but is just unnecessary. So I don't know if it's more of a barrier or just additional compliance that people don't even realize exists that probably just needs to be removed. And then the last one was, this kind of goes to the out-of-stater thing again too, is say you had requirements to be 2,000 hours trained for your license, and where you're from it's 1,500 hours and you've been doing it for 20 years. I think in some situations that can be waived, but in other situations it's like, what's more important, having someone go back to school to hit that checkbox, or to just say, hey, this person's obviously been doing it for 20 years, and forcing someone at the end of their career who's relocated to now go back to school to get those hours seems a little bit unnecessary when they're already doing it. So is years of experience more important than hours? And, I think that's an important question to have as well. Thank you.
Thank you, sir. Any comments related to any of those suggestions or something different from a panelist? Yeah, Kristen, the yellow hand went up and the physical hand went up. So it must be
Yeah, I didn't know what to
important.
do. So on that, I did a little bit of looking into that because I had that same thought. And from the nursing standpoint, I think there's like 21 days of exemption where you can work in the state of Montana if you're from another state. So like we allow that without a specific license for the state of Montana, which I think is really nice. But as a provider who has a license now in Wyoming and North Dakota, it's almost impossible to go and look at the exemptions from other states to comfortably practice in that other state. So I don't think it's really inviting for that. And in the interest of increasing the licenses of professionals like nurse practitioners and physicians and PAs and the like, I think that having some sort of a sponsorship thing where if we were able to advertise and tell them something along that line and get some of those sponsors, like to get more the out of state people licensed where they could do that.
It appears Mr. O'Connor has a comment about this. Not surprised.
I have comments about most things, as you know. Thank you. I just wanted to briefly raise regarding Senator Zolnikov's second point, that in 371304 subsection 3, this was actually a change made last session. We specifically authorized the board statutorily to consider other experience. So for exactly the situation that you're talking about, if you've got the 1,500 hours, that's what's required for licensing, but you've been doing this for 20 years, great. We absolutely want the boards to consider that. And that was a statutory change last session. It is a new statutory change, so it's in early stages still, and how much people are talking about it, I don't know, but I did want to just throw that out there so that folks are aware.
All right, additional topics for consideration. Floor is open. Troy.
Can you guys hear me okay?
Yep.
Okay. So what was that statute he said? 37-1?
304.
And that allows, I just want to be able to look it up.
Sure. So what it specifically says is that it's the substantial equivalency statute. And so the boards are supposed to first look to substantial equivalency, which is the other state's requirements at the time of their application into Montana. But another thing that was new there is that if they are not substantially equivalent, there is a specific determination of whether the actual qualifications and work experience overcome the lack of substantial equivalency. And so it's exact. I think I even used that or a similar example at the podium last session. If you've got 1,500 hours as your experience requirement, that may not be substantially equivalent to our obligations in Montana for licensure, but you've been doing this a very long time. We should be taking that into consideration. And so this gave the board's authority and obligation to look at those experiential requirements. Those are still up to the board, whether it is enough to overcome the lack of substantial equivalency, as is the determination of substantial equivalency. But it gives them that ability to look at that the experience that the licensee specifically has and overcome that their state requires less than what Montana does.
Okay, so along that lines, I think some states also have a pathway that allows you, if you're licensed in another state in your profession, and that license, you've been licensed there for 12 years, is the number that I think Wyoming has for surveyors or engineers, that you can then apply to Wyoming with a pathway of being licensed in your state on 12 years. And they look at that as a separate pathway to then apply, because you may not meet the education, or you may not meet, one of their other, but they still have a pathway that is based on you being licensed and therefore experienced in your licensed profession. And I know right now surveyors and engineers do not have a license type pathway. And so I think that kind of falls in this years of experience thought process. So it becomes a barrier, because I've had surveyors that have been licensed in other states for 20 plus years, but can't get licensed in Montana because they don't have an associate's degree, if that makes sense.
And I don't know that I could speak to a specific application type, or certainly not what Wyoming is doing. But I can say that's certainly something that the board can look at based on the experience of the licensee without further statutory change.
Okay, thank you.
All right, Brad.
Yes. Hi, everybody. Brad Longcake. I have a question or kind of a thought in terms of the number of licenses that could be a barrier. And the specific example I have is for the funeral director / mortician. They're required to have several licenses to operate their business. And examples of that would be you need a mortician license, you need to license your mortuary. If you're a crematory operator, you need to have that license as well as license that facility. And then there's also a crematory technician for an individual that's not a mortician to operate a crematory. So there are several licenses required that we feel could be under a mortician license, and then just have endorsements that you've accomplished the skills that you need to provide those services. I know there are additional forms of disposition that several legislators are looking at, as well as the Board of Funeral Services, that they'd like to add. And rather than requiring additional licenses for those forms of disposition, we think we could easily capture that under the endorsement, utilizing the mortician as basically the tip of the spear, if you will. So it's a way that we could eliminate some of the licenses, but still continue to provide the resources and support that we need based on the scope of practice that license would allow those individuals to do. So just wanted to bring that up as an opportunity for discussion, Mr. Chair.
Thanks, Brad. I would expect there'd be other license types that have similar constructs that could be worthwhile looking at in terms of endorsement versus licensure. Additional topics for consideration. Senator Zolnikoff.
Sorry, one slipped my mind, but this is more, I don't know if it fits. I'll just say it so Charlie can hear it here first. I know that maybe this is more on the health inspection side, but where you need to get that license. And it's a different type of license, not professional or occupational. But for smaller food businesses, they require the whole thing as if you're have a huge kitchen in the back. Even if you're doing very minor things, you have to do a whole bunch of training. And those types of standards, maybe they're doable, but they're unnecessary and add extra expenses. To know how to cook a chicken to the right temperature when you're only making coffee and it's only a coffee shop. So some of it's on that morticians. It's like it's too much for what's going on. And maybe we just say it's good enough and nothing's perfect, or maybe we can simplify that for the people it doesn't apply to. But
Thank you, sir. Hope Director Brereton made notes. I don't know that that falls under the purview of Title 37 or not, but we can certainly explore it if
I'm sure it doesn't, but we can't help but go and take a tangent. So sorry about that.
Fair enough, sir. I appreciate it.
Noted.
Jason.
Yeah, I have some suggestions to help the licensure barrier underneath plumbing. And instead of kind of reading off this long article, and you guys may be kind of familiar with it anyway, I was wondering if it'd be slightly more appropriate just to email it to, I don't know, Aaron or you or whoever. And it could be, if there's a viable topic in this, maybe it would be brought up next time. And essentially this was written up by some of the plumbers, and it's pretty easy read. It's all redlined, and I can give you one example. So under 3769-304, this statute indirectly requires apprenticeship. Legally obtained experience can only be obtained by working under the exemption 3769-102. It is difficult to determine what is meant by 3769-304, section I, subsection I. So this would request a removal. This is actual kind of heavy code alteration, so I just feel maybe it's better to let you guys look at this first to see if we want to address it.
I'll let Aaron address how those types of documents should be best disseminated, if that works.
Yeah.
Yeah, absolutely. Thank you, Chair, and thank you, Jason, for that. So those comments were actually submitted to the construction committee last week. They're also for the full board or the full task force to see, but I do want to report that the Board of Plumbing actually had its board meeting yesterday, and I attended that, and we spent, I think, almost 2 hours going through their entire Practice Act, and we had a really good session and went through, and I took really good notes, and so we addressed that entire document, and you're welcome to submit that, and I can provide it to the if you want to email it to me, I can, or if you want to send it in through the public comment portal, then we can submit it into the record, and so everybody can see what you're talking about, but we're going to go ahead and come up with a draft proposal for the board to review based on those suggestions, and then plenty of others. And so that was a public meeting. It'll be available for anybody to review if they are interested in it, to see exactly what the Board of Plumbing came up with as far as some suggestions for red tape reduction and other updates to their Practice Act.
Okay, wonderful. I'll just send that to you, Aaron.
Okay.
Thanks. I think Jen had her hand up next.
Thanks. Sorry, had to find my mute button. Am I echoing for you guys?
Sounds okay.
Okay, good. Sorry. I'm putting these two suggestions in the bin with the absolute understanding that this is not within the scope of Title 37. And I made a commitment to myself that I would bring these up at every opportunity because it is such an important topic, right? Making sure that these professions are filled efficiently in Montana. So two of the big barriers that I keep hearing of over and over, perhaps not to licensure, but to actually getting to practice, are one, provider rate reimbursements, especially for speech language pathologists, physical therapists, occupational therapists, audiologists. We're training them up in our state. We're not paying them enough, and so they're leaving, choosing not to get licensed here. So that's would be in the parking lot issue. The second would be insurance credentialing, private insurance credentialing, and how quickly that can be turned around, and if there can be a requirement that commercial insurers that are able to be regulated by the state of Montana provide something like a provisional credentialing while the full thing is happening. So there's not an extra 90 or 120 days tacked on to the end of the licensure progress. Again, both outside of the scope of this specific committee, but they contribute to the overall picture of what we're trying to accomplish, I think. So I'd be remiss if I didn't mention them.
Thanks. I'll let staff take note and we can decide if and when we want to broach those additionally down the road. Representative Seconder.
Thank you. I've got three things here. When it comes to criminal history, I don't think we should be solely focused on felony history. Misdemeanor history in many ways is actually harder to get off your record in the state of Montana than felony history. And that does prove to be a barrier for people for time to licensure. Doesn't necessarily mean they won't get the license. It's just going to take a lot longer. My second thing is there are a handful of licenses, to my knowledge, that are seemingly arbitrarily age restricted. Fishing guides, cosmetologists, barbers, EMTs, and there may be more. But that in addition to educational requirements, you also must have turned 18 years old. There's a young man that I knew very well. His dream was to be a fishing guide. He was homeschooled, and at 16, he went to apply and was shocked that he had to wait another 2 years before he could get licensed. I have other examples along those lines as well. And then my third point is ensuring that our licensing requirements are in line with other states. I would send an email by a constituent that they're going to get, I'm in the car, so I don't want to quote the license type, but they were going to go get licensed in California and return back to Montana, where we would honor that license here and then license them here. And it saved them a decade of work experience to take that route. So those are three things. I look forward to someone's response to any of those. Thank you.
Thank you, sir. Jen, did you have additional comment or did you forget to lower your hand?
Forgot to lower, sorry.
No, you're good. Sierra, do you have something to offer? Maybe you want to introduce yourself since I think you were late to the team.
Yes, thank you. This is Sierra Reesberg representing the Behavioral Health Alliance of Montana. Similar to what Jen raised earlier, more the challenge with beginning to work at an organization. And I think this has been brought up previously, but I'm not sure that it's specific to healthcare, so this might be the place to address it. Is the processes, the different processes between professional licensure and then organizational credentialing requirements that are currently separate but are somewhat redundant or duplicative, and potentially addressing those processes that so we can share information or just streamline the process altogether.
Great, thank you. Additional ideas from anybody? I have a couple that I'll mention. One having to do with alternative pathways. There's been some mention of it in terms of educational requirements. I'm curious to know if there are other states or other licenses that have alternative pathways that may include apprenticeship, that may include, stackable credentials instead of degrees. I'm wondering if there's an opportunity for us to explore those alternative pathways to licensure. Another thing, I guess it's more has to do with relicensure. I'm curious to explore the utility of some continuing education requirements, whether or not that's actually necessary for continued professional behavior in a particular license type, or if those are overly burdensome. And then also interested to perhaps talk about those license types that have certain supervisory requirements for a certain period of time before someone that has demonstrated all the other aptitudes associated with that profession, but it does not have the appropriate amount of supervised activity yet, whether or not that's a barrier to someone meeting or having the opportunity to work to the full extent of their license. That's something I'm also interested in exploring. Kristen.
Hi, thank you, Chair. In the public comment, there was some comments about application delays and background check delays, and specifically with it related to nursing, but I know that that's a theme across multiple of our licensees. And I think it would be good to have a review of how much of this can be automated. I mean, we're in that and versus going through some of the staff departments for licensure, just general automation through the technologies that we have. And I think that really suits the purpose of this initiative. And then another issue which doesn't follow under 37, but was in the public comment, was about the way of improving access to care in rural health settings and the licensees in those settings, and at the Board of Nursing level, and kind of addressing this idea that our state licensures are more frequent than our national licensures. I think that's actually a safeguard that's necessary in the nursing part, and some of the professionals that manage medications because of the diversion stuff and addiction. And so there's a nice safeguard by doing that. So I would answer it that way. But the secondary part of not having enough licensees or care in rural healthcare parking lot issue would be to look at that through allowing those services to be offered through telehealth, because the licensees, it's just going to take some time before that comes around, if at all. The reimbursement and the allowability for those services to be paid through telehealth, like intensive outpatient psychotherapy, which would address your licensed addiction counselors and your licensed social workers and that whole thing. We could make them more accessible just by paying those services through telehealth.
Great, thanks. Additional topics for consideration. I would offer that I don't believe that this is the end of your opportunity to provide ideas for the task force to consider. So if there's something that comes up down the road and we want to interject it into our committee work, that opportunity will currently be provided down the road as well. All right. Seeing no other hands raised at the moment, we can move on to the next item on our agenda if there's no objection. So reviewing the executive order initiatives. Aaron, I think you have a kind of an approach you've been taking with this, so I'd throw it back to you if you wanted to provide your feedback on that item.
Sure. So this is moving on to the second page of that initiatives and priorities worksheet that I provided to the committee. And really all this is to kind of put in front of the committee the call of the executive order. And there are two main topics that the full task force has to provide recommendations for, and are the purpose of the task force, and that's identifying and removing burdens and barriers faced by licensees that are not necessary to protect the public, and improving access to and availability of professional services for citizens across Montana. And in order to accomplish that, there's several questions that should be answered within this final report that the task force is compiling by September. And so what I did is I listed all of them on that second page, and then kind of went through and gave my best effort as to if this committee should keep these questions in mind, answered yes or no. There's a couple that are blank. And so these are my ideas. The committee can say yes, that's a great idea, or no, that's not what we want to look at. And this doesn't need to be answered right now, but this is just to kind of give you an a friendly reminder that these are the questions that really the task force and the committee should be keeping in mind as you go through your work. So for the barriers subcommittee initiative, the ones that I thought really should be kind of front of mind are whether the unregulated practice of an occupation or profession creates a direct, immediate, or foreseeable hazard to the public health, safety, or welfare. If there's a public benefit provided by the license, if the qualifications of for licensure are justified, obviously, if unnecessary barriers to entry exist for applicants, if the existing licensing requirements contribute to workforce shortages or access constraints in rural frontier communities, whether licensure portability, reciprocity, or endorsement pathways could expand access to qualified professionals, particularly in rural and underserved areas. And I think that was it. So there's really there's 6 of them. There was a couple that I left blank, and so you can talk about if you think that those could be questions that you should keep in mind as well. And that is if licensure significantly increases the cost of service to the public, or if public support exists for continued licensure for each profession. And you don't have to answer these, and this is really more just to kind of keep you on track, because there's a lot of ways you could approach barriers for licensure, as you guys just discussed over the last 40 minutes. But I did want you to remember what the final report, the questions that should be answered as you go through your recommendations.
Great. Thanks, Aaron. Any comment, feedback on that item? All right, moving right along. I dig it. So next agenda item is to identify top priorities. I'm not sure if we have a means or a mechanism to do that right now. Aaron, what are your suggestions on how we approach identifying those top priorities for this subcommittee?
Thanks, Mr. Chair. So, I don't have a really great suggestion for you. I mean, I took some notes, and I mean, I think you could maybe just have people throw out what they feel their biggest priority is, and then from there you can narrow it down. Really, the idea here is to come up with ideally what you want to talk about in the next couple meetings, and some directions for me on the data and analysis you want me to come back with in a month or 5 weeks or whenever we meet again.
That sounds like a lot of pressure.
Yeah.
Anybody have any comment or feedback for Aaron? I don't know if has any other subcommittee used like a polling type mechanism to summarize the various recommendations that we've come up with today, and then poll on what the most valuable ones would be from each of our perspectives. Have we done anything like that?
Mm-mm.
Would that be useful? I think it would be useful from my perspective rather than trying to provide direction at the moment. Having a chance to look at all the ideas that came forth and then give a ranking of sorts. Senator Nolan?
Thank you. I would just like to say that what you just said is probably apropos. It's right on. All the points that, like Stacy brought up, former Senator Small. I think there were I only counted 8. But all those ideas look like they would be our base, and then we get to decide. So I'd just encourage whoever was taking notes, bring those up and say, yeah, these are all, like you just said, Mr. Chairman. These are the ideas. They were listed. Ms. McCoy had some good ideas, and they were all of them were good ideas. So I'm not saying that they weren't. I think every one of those ought to be listed and then tallied, and we can say, yeah, I want this, this, and this.
That's something we could do, Aaron, you think?
Yeah, I think that we could do that. So I do want to just keep the committee mindful of the time that we have. So there are 5 meetings that we have scheduled. So there's one in each month up until September. We do have 5 weeks until the next meeting. And that's because there's spring break in between. And so we won't be meeting exactly 4 weeks from today. We'll be meeting 5 weeks from today. So I could put together, I can go back and rewatch this meeting and come up with a list of what everybody said that they wanted to look at, and then send out a poll. I would need to have everybody commit to getting that back to me as soon as possible. And so I can start to devise something, but we do need to, I don't want to waste the next meeting. And so we do need to at least come up with something to talk about at the next meeting. And so if you guys could have a quick discussion and maybe come up with as a group what you want to look at first. It's kind of easy to go from there. Some of the other committees, it was a little easier to, and you guys were all there. I mean, you guys have all served on at least one other committee. So it was kind of easy to say, well, this was a natural grouping that, these 5 things that were thrown out all kind of have to do with administrative burdens or, something like that. And so if you guys want to look at the the reentry aspect of things, the criminal history, the criminal background and that kind of subject, that could be one. Or the qualifications, qualification burdens, that could be a different topic. I'm just kind of throwing out a few high level categories that some of these other ideas could be kind of grouped into, and you could maybe organize your topics that way.
Senator Nolan.
Thank you. I also like what Mr. Longcake brought up, but I had a question, Mr. Chair, for Senator Zolnikoff, if he's still on. And if he's listening, my question is, so we've been on a couple of different committees, like Aaron just said. We put things out. From your young mind and experience that can grasp this stuff, did you see anything different? Do we need to exclude anything? Or because my comment, I don't think it was off base, but I need to see it all in print. I don't remember. Senator Zolnikoff.
I missed that. Sorry.
Yeah, I don't know that you're babysitting, but my question was,
it's just being a father when you're with your child. Come on, Mark.
Sure. I know. My question was, I asked if Aaron or whoever's taking notes could get all the stuff that we talked about today and formulated. She just explained how that could happen, might delay us, but in your very sharp and quick mindset that you have the ability to grasp everything, and my older mind doesn't do that so quick as it used to. Did you have, and we've said on these other committees and we've heard how things are transpiring so we can move things along. Did you have any other insight of what we could do, should do? Because you're so bright is what I didn't want to say, but I guess I'll have to say that.
That was a lot. No, I mean, I think I gave everything I could think of right now. So we'll see what they compile. And again, a lot of this was off topic, and it's good to put it out there, but I have full faith that this is going the right way. So, yeah. Thank you, Mark, and everybody.
All right. Thank you both. Kristen?
I was gonna suggest that maybe one way that we can categorize it or organize it so we can organize our conversations and progress is, as Aaron suggested, is reentry. They have very specific barriers to licensure that's unique to them with that's going to be one kind of aspect, and then we have this other professionals that are licensed or near licensing that is another subsection that I think would maybe be more aptly a conversation in another setting like the LACs and the LCSWs and the and maybe the more professional roles, and maybe a third role that is the more blue collar that has the unique, like how much is necessary for licensing and what are the barriers that are listed to that. So maybe by separating it from the barriers for those like subsets might help us be a little more productive in each type.
Okay. Any other comment? We have a comment in the chat for those that don't have access. Another topic, forcing someone managing a short-term rental to get a property management license if they aren't a family member, even if they just manage 1 or 2 Airbnbs for a friend.
Just to be clear, that's what you're suggesting, Senator Zolnikoff?
Over licensing requirement, like, do you need a license for such a simple one-off? And if I can do my own without a license, why does somebody else doing it for me need a license? Is there additional if I own 2 properties, do I need a license? No, but if someone else manages 1 or 2, why would they? Topics like that. Why isn't there an exception for me personally if I owned it but not someone else? Why would we do that? I don't know.
Okay, so what I can do is I'll do this is similar to how the last week's meeting went. They had, with the construction subcommittee, they had a lot of really good ideas. They were unsure kind of the overall picture where they wanted to go. There, like I said, there was other subcommittees that kind of they were able to set a clear path, like this meeting, we want to do this, 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 and this. You guys have a lot that you want to consider. And so I can go through and come up with a suggested plan of action, just kind of based on what I think, how I can categorize it. And I'm happy to send out a poll, and so I can get your level of interest and your priorities. So I will work on that and probably won't have it to you today, but by Monday I send something out for everybody. For the next meeting, what would you like to see as far as some data to provide? Just so stuff I can start working on, so we have a productive next 5 weeks.
Jen.
Erin, I'm just thinking of some low-hanging fruit that popped up during this meeting. I think that Stacy's suggestion of looking at the clinical lab scientists is good, and I don't know if there are any on as members of the public here today, but I would welcome a conversation with anyone. But I think that maybe we can dig into those details, like what other states require, what Montana requires, the difference between Montana requirements and national requirements, other relevant details. You're, smart, so I'm sure you'll think of other nuance to bring up, but that's one that I can think that popped up during the conversation here that I think we could either put to bed early or it would open a good conversation.
I think some data that I would be interested, Aaron, is just timeliness to licensure and understanding what, if any, barriers exist from someone being granted a license, particularly on those that are delayed for a long period of time, if that's possible. I think denials would be an interesting piece too, if they're to what degree are we denying licensure applications and for what reasons. I think that would be useful data for us to review as well.
Okay.
Kristen.
I think it would be helpful to understand maybe numbers generally of unemployment of reentry individuals, and then I don't know if it's within the scope of this. I think that lack medication adherence makes them unable to actually become licensed because their mind isn't working straight. So I don't know if that would be a good data to have. Is medication adherence or recidivism rates through whether they're licensed or not licensed, or recidivism rates versus whether they have employment or not.
Okay. I'll probably need to reach out to my directors on the call for a little bit of help on some of that data. So I'm very thankful for Director Strauss and Director Brereton being on this committee.
Sorry to put so much work out there.
We also have the Office of Reentry that was established last session that could be a very useful thing for us to bring to this conversation. Jen.
Thanks. I have put the request out to one of my clients, but I also plan on copying a broader audience of disability advocates to see if there are any places where either the department or the licensure process could be adjusted to accommodate individuals with disabilities or accessibility issues, et cetera. If I get some of those suggestions, I'll for sure send them over to Erin and copy those on this list. But is there another way you would like to receive those suggestions after this meeting to maybe increase visibility to anyone?
Erin, I'll let you answer.
Who else should I loop in on the stuff that I'm asking for after this meeting ends?
So you're asking for a specific, I'm sorry, what are you asking?
That's okay.
For how to submit stuff?
I anticipate that I'm going to get some feedback after this meeting is adjourned that I would like to pass on and maybe suggest for future conversations or suggest as a priority or would be a quick research or something. If I'll of course send it to this entire subcommittee and to Erin specifically. Is there a specific way you'd like that feedback other than email? I know that you're setting up a SharePoint for us. It is just sending a note.
And so we determined that since all of the documents that I have been sending out and all of the data that has been requested that we will start disseminating starting with the next week's meeting with the healthcare committee, it's all public. We didn't really see the need for a SharePoint site. So the website houses all of the meetings and agendas and documents that we've been providing. So we didn't see the need for a SharePoint site. If you have comments, if you're collecting comments from stakeholders, just encourage them to go to the comment button, because that's the easiest way for us to collect that. It's just one repository. It's a form that goes into our system. And so that's a lot easier than us trying to get them in our email. Goes to a bunch of different emails, and then we have to save it into that system and then compile it all into those PDFs that we've been emailing and posting. And so yeah, that's that. But if you do email it to me, then it just gets PDF'd and sent out and then posted to the website.
Thanks so much, Erin. I appreciate that.
Troy.
Thank you. I had a question maybe for Erin, and I'm not sure if you would know the answer or not. I remember being tasked with determining substantial equivalency for engineers and substantial equivalency for land surveyors. I'm curious if other licensed professionals, if those boards had to go through substantial equivalency evaluations and evaluate all the different states for if the different states were substantially equivalent.
Yeah, I will. I see Quinlan jumped right on. The answer is yes. And if Quinlan wants to expand on that, he certainly can.
Yeah, short answer is yes, absolutely. Slightly longer answer is that's been a long-term project that the executive officers for the various boards have been working through. following on the legislation that I referenced earlier in response to Senator Zolnikov's comments. There was legislation defining better what substantial equivalency meant, and tasking the boards with figuring out what is substantial equivalency. Then, in the interest of full transparency, the department developed charts that outlined which states were and were not substantially equivalent, and we've been going through a rulemaking process across all of the occupational licensing boards to adopt those charts, so that people who are interested in coming into the state, who are licensed in another state, have as much transparency as possible about what is and is not substantially equivalent. Is the state that they're coming from equivalent, or is it not, according to the boards? And so that we can make it as simple as possible. That, of course, also helps the staff process those licenses, because if the board has already determined it's substantially equivalent, that they can grant the license much more quickly and get people to work. If they're not substantially equivalent, then it would fall into the non-routine process and be presented to the board for consideration. So yes, you're not alone. Everyone's doing the same thing.
And so I didn't know if there's some data in that would be related to, say, some of the professions that is out there. I mean, those spreadsheets were phenomenally helpful in understanding what other states have compared to what Montana has in a right in front of you Excel spreadsheet. So if there was to be data shared with other members of this, and they had questions, what does that other state have for electricians? What does that other state have for plumbers? What does that other state have for, pick any of these? That seems like a good one spot to be able to look at that information. So I don't know if those are available, I guess, Aaron, to share how that would work.
They are published on our website as part of the rulemaking process for each of the boards on the board's website, but we can work on compiling them so that you don't have to go to each of the board's website on our super fun and awesome website.
Thank you. And I believe that was a question in the chat from Alan as well, for copies of those tables. So we'll work on that as a data request. Thank you.
All right, Stacy.
I want to first thank everyone for their patience as I bring up sort of a new issue near, an hour into the call. I've been traveling all week, so I just got home like 10 minutes before this call, so I'm organizing my thinking on the go. But one of the things, particularly in healthcare, which is where I work, is that, and it came up on public comment before, is that healthcare licensing and certification is absolutely necessary in the billing and payment sphere, right? Without a license, without a certification, it's very difficult to make the case with our payers that particular professional should be reimbursed. There are circumstances where, in the case, like the good example that I have is community health workers were authorized for Medicare reimbursement at the federal level. And so now we have to individually certify our CHWs to get Medicare reimbursement for that individual. We do not have CHW certification or licensure in the state of Montana. And I know there's a lot of fatigue around creating new types of licenses or certifications. I would be curious if there are models from other states where it's more of a registration process and there's other certifying bodies that the state acknowledges in order to reduce the burden on state admin, but still gives a pathway for sort of state recognition of these types of licenses or certification. Like most of its healthcare extenders are not like the top tier docs or DOs or dentists, but there are a lot of the support staff that we're now using to build out primary care teams or dental teams to extend our ability to deliver services in rural Montana or increase access to our patients. So I don't know it exists out there, but I want to throw it out there because it's been percolating in the back of my mind since last session. So yeah, it's a barrier, but a barrier to payment, not necessarily a barrier to the certification or licensure itself, which they're intertwined in healthcare.
Yeah, I think we had a couple topics that kind of had similar relationship to licensure. So perhaps worth exploring. Any other final comments on priorities? Kristen snuck in.
Thanks. I feel like I'm like monopolizing. Just to piggyback on that comment about the barriers to care, and that's not quite licensure, but tied into this is the discussion about. I mean, this is brought in part from the rural health transformation information, but I just want to just put a little plug that here or for the parking lot as this all kind of transpires is everybody has the right tool in their pocket with their smartphone and their internet. And so there's a lot of this that is overdone and unneeded because it's new age technology and we all got it.
Okay. Thank you. Anything else for on the agenda before we move to public comment? You want me to read the thing, Aaron, and then you can facilitate it?
Yes, please.
All right. So the subcommittee now offers the public in attendance an opportunity to comment on any public matter under the jurisdiction of the subcommittee that is not on the current agenda. The subcommittee cannot act, but will listen to comments and may ask staff to place the issue on a future agenda. The chair may limit the comment period to proceed with the subcommittee meeting. I don't have a plan to limit comment right now, but just please be respectful and mindful of other people's times. And if there are repeated comments, maybe just say, I agree. So with that, Aaron, I'll give it to you to promote people for public comment.
Okay, great. Thank you. So if you are an attendee and you wish to provide public comment, please go ahead and raise your hand and I will call your name. And then when it's your turn, please state your first and last name. And I'm going to go ahead and read one comment that came through on the question and answer chat. And if this person wants to also provide public comment, they are certainly welcome to, but I'll just go ahead and read this. This is from the Q&A or the chat. It says Montana currently has a licensed veterinarian LVT program. This has created some help in the shortage of veterinarian services, but it is very limited and does not address the need for in-field services for large animal, especially in rural areas, farm and ranch, and other critical needs that are not being served. Could there be an expansion of the licensing to create a veterinarian practitioner similar to what has been done in the medical field? So that was a comment that came through the chat. So that's that. Okay, so first up is Keith Allen.
Hello, committee members. First of all, I'd like to thank you all for serving on here and what you're doing and going through. My name is Keith Allen from Helena, Montana, and that's Allen. I'm a master electrician, and I did my apprenticeship last century. My comments center only in my dealings with the state electrical board and our statutes and rules. I've been involved with the public process of that board since 1998, and I've been at almost every meeting. Going back even before the current governor, there's been many statute changes and administrative rules changes, and almost all have seemed to have been meant to streamline everything around the boards. And as a licensee, I feel we've been streamlined to death and dumbed down about as far as we can go. What I've noticed most from my level of observation and also helping electricians, most of the delays the applicants experience obtaining their license revolves around their own lack of providing the required info to the board, and if they are reciprocating their license, the slowness of the state or area or jurisdiction they're coming from in providing the information that they're in control of. And that's nothing we as the state of Montana can do to speed up another state to help their licensee get a Montana license. Over all these years, I've witnessed a large decrease in the number of FTEs the DOL has in the positions that deal with licensure. As a state, we've greatly increased the number of licensees and apprentices. We still have a lot of applicants every month, and I feel we have not increased the number of FTEs in the Department of Labor and the Apprenticeship Bureau that are needed in order to effectively administer and police this increase of licensees and workers. And we have to remember that licensure is for the protection of lives, personnel, and property of Montanans. And with the Wild West that's going on out there in the construction industry, there's not really any proper enforcement because of the lack of FTEs. People know they can get away with just about anything, and this is not good for the safety of Montanans. So, in closing, if you're a good worker, a good learner, and have been properly trained by your employer and journeyman, I don't believe there are any barriers to licensure as long as you can pass an open book test to get your electrician's license. So that's it, and thank you. Have a good weekend.
Thank you. Next is Adam Schaefer.
Thank you. I'm Adam Schaefer, SCHAFER. I'm with Intermountain Health. We have hospitals in Billings, St. Vincent Hospital, Holy Rosary Hospital, Miles City, and St. James Hospital in Butte. And thank you for the opportunity to provide comments. Our comments will center around the security guards that we hire for to be employees in our hospitals. And I would like to bring forward two significant barriers that we see affecting our ability to adequately staff hospitals security teams. The first is excessive delays in fingerprint and background processing, which I know the subcommittees discussed. Licensed security guards are experiencing delays of several months in receiving fingerprint clearance, which creates bottlenecks that leaves hospitals without essential security coverage and security guards who cannot perform their duties. We've experienced significant delays up to over 3 months, and we're also experienced typically from 4 to 6 weeks for applicants to receive their background checks. We also conduct our own background checks internally, but we have to wait until the state's background checks are complete before we can allow the employee to perform security guard duties. We have also been told that fingerprint background checks might be processed faster if they're done in person in Helena. And so it's not financially possible for us to send all of our security employees from Miles City or from Billings to Helena to take advantage of that. So if there's a solution to that, we'd be open to working with the subcommittee on that. The other one is the inability. Number two would be the inability for prospective applicants to begin licensing before they're employed. Current regulations prevent applicants from beginning the licensing process until they're officially actually hired, adding unnecessary time to the onboarding sequence. We'd encourage the task force to look at potential education or credentialing programs for pre-employment licensing for Montanans seeking a career in security. The subcommittee could also recommend changes to rules that would allow for a security guard to obtain a provisional license if the employer, such as us, has conducted and attested to completing its own background check on the employee. We've had very positive discussions with the Department of Labor as we've worked through these issues and appreciate their help. But we do think that these are two areas that could help us get more Montanans to work who want a career in security in our hospitals. We look forward to hopefully working with you on these issues, and thank you very much for your time.
Thank you, Adam. Okay, next we have Kyla Hailstone.
Good afternoon, Chair and members of the Barriers Task Force. My name is Kyla Hailstone. I am the director of the Montana Family Court Awareness Project. I am also a paralegal, investigator, and family law specialist. I speak to you today as a seasoned victims advocate and in hopes to ensure we are bringing balance with public safety when we're talking about these barriers. To kind of bridge off what Kristen had talked about, we can't necessarily treat all these licenses the same. We have many licensed services that intersect with health and human services, especially when we're talking mental health and medical providers. We all agree that our state faces a critical shortage of licensed mental health professionals and medical providers. However, expanding access to care without anchoring that access in robust safety, ethics, and accountability standards is not progress. It is a catastrophic public safety risk. Our concern is that we can't prioritize the sheer quantity of providers by removing barriers over the quality and safety of the care they provide. This is grounded in 3 different concerns for us. The first is revolving around the licensure of criminal offenders under Title 37. We feel very strongly that we need to establish uncompromising safety barriers against licensing individuals with violent criminal histories and licenses that involve public health and human services. It is unacceptable that individuals with records of violent, intimate partner, family member assault, or PMFMA, as many of you know, sexual assault, coercion, or child sexual exploitation could gain public licensure to provide vulnerable individuals with behavioral health and medical services without a strict public disclosure and mandated safety measures. A professional license is public trust. It's not a private entitlement. Obscuring a provider's violent background under the guise of subjective privacy violates public's constitutional right to know and places us as the consumers in direct danger. Second, we are witnessing systemic failure in verifying provider competency, education background, and experience. We are also noting there's a lack of mandatory training audits to ensure that even once they get their license, the yearly continuing education or CLE credits are actually being obtained. In the mental health world, particularly focusing on trauma-informed care and core ethical consumer protections. Again, we're dealing in these licensures with protected health information and very vulnerable individuals. So we need to ensure that providers are not being allowed to practice these particular public licenses without verified up-to-date experience. This is not a barrier, it's a necessary regulatory tool to ensure safe and effective care. Third, along with the comment from Keith, we are noting that the public is being shut out of the disciplinary system when we're talking about these licensures. We're seeing administrative barriers in the complaint process and a lack of public transparency regarding providers who have violated the ethical obligations of their license. We are seeing particular boards misusing claims of attorney-client privilege and utilizing ex parte and formal proceedings to dismiss approximately 98% of public complaints behind closed doors. This is effectively insulating bad actors from accountability and creates a significant barrier in public transparency. So I'm here urging this task force to acknowledge one non-negotiable truth. The MDLI boards have a statutory and moral obligation and duty to the public. We ask that their focus be on not only helping with these barriers to ensure that we do have good quality providers, but also ensuring that we're also enforcing these ethical standards and prioritizing public safety. Bottom line, access to care must never mean access to harm. And I thank you for your time.
Thank you. Okay, Jackie McBroom.
Good afternoon, committee members. My name is Jackie McBroom. That's McBroom. I'm an electrician, pardon me about the phone there, in Montana. And I would just concur with what the lady said right before me, and also what Mr. Allen had said. It's a big safety issue for electricians, or not electricians, but for the public in general. And for us not to have licensure, it is the Wild West out there. Things are not getting handled the way they are as of date. And just nobody really cares until someone's house burns down, right? And I can also say the same thing for plumbers. If it's not plumbed correctly, there could be backgassing coming in the house, and that could also be detrimental to everyone's health, and not to mention cause deaths. So that's all I have to keep it short and sweet. I really appreciate what Mr. Allen had to say because he really covered everything. Thank you so much.
Thank you, Jackie. Okay, and then we have Robin Gard.
Good afternoon, Director Strauss and members of the committee. My name is Robin Gard. I am the supervisor of the Office of Reentry for Department of Labor and Industry. And since I got the shout out from Chair Strauss a little bit ago, I thought I would just take a minute and introduce myself, offer any assistance, collaboration, partnership that the committee sees fit, and look forward to the great work that's being done. Thank you.
Thank you, Robin. Okay, so last call. If anybody wants to provide public comment, please raise your hand. And I do have one more chat comment that I will read. It says, accepting insurance as a biblical counselor is currently difficult because the insurance industry is built on a medical model that prioritizes state-sanctioned clinical licenses such as LPC, LCSW, and evidence-based psychological treatments over spiritual or religious ones. What can be done to overcome the barriers, bias, and discrimination against biblical counselors who have helped thousands of people dealing with mental health issues, emotional behavioral issues, and relational marital issues? So I believe that's it. Hold on. Oh, sorry. I do have one more. David Alvarado.
Hello, my name is David Alvarado. I'm the person that presented that question that she just read. I have a biblical counseling master's degree, as well as a bachelor's in psychology and associates in intercultural studies. I wanted to educate myself, understanding the whole person, and yet, excuse me, even going down that route, if I don't have licensure, then my practice of counseling people who desire choice, right? A patient should have choice and religious access. They want someone who has their same worldview, their same morals and values, their same ethics. They're unable to actually receive my services because I have to be private pay. So their insurance will not cover counseling from me as an individual. Just a little bit more background. I worked as a program manager for over 9 years in a group home setting for at-risk boys and girls. I've seen counseling done, CBT, DBT, other aspects, and I could see that they were only addressing surface issues and not addressing the whole person. And that's why I personally have seen, and even research shows that those settings has not produced high success rates. What I would like to do or present, I guess, to the committee is if we could get past the barriers of credentialing. Obviously, if we need to get certified as biblical counselors, that is absolutely sound and it's good. But I know that there's the credentialing barrier for those who want to counsel, but they cannot because the insurance companies will negate or deny their certification because it doesn't meet the standards, right? Or they view the counseling that a biblical counselor offers as lay person or clergy or pastoral care counseling, and they don't see that as being a healthcare provision or a medical provision. So I think offering a solution that could work would be the state legally recognizing the religious certification through institutions such as ACBC or ICBD or CCEF. These are just institutions that do biblical counseling. Then there's the medical necessity wall, which people have to be diagnosed with a label from the DSM-5. And I've seen kids, worked with kids for years, and they carry those labels into adulthood. And then they say, and I'm not saying everybody does this, but they say, I can't overcome my anger or I can't overcome addiction because I have this disorder or because I have this disease. And so that doesn't offer them any hope, right? Because then they think it's going to be an ongoing cycle that can't be broken. I guess my last comment, because I don't want to take up too much time, is that we can provide them hope, right? Because it's just a matter of making amends with God and asking Him for help. I know that AA and NA utilize a model similar in the sense that you're looking to a higher power. We're just offering them the source of their healing, their deliverance, their salvation, their forgiveness, their mercy. And so I will end my comment there.
Thank you, David.
Is that it for public comment, Aaron?
Yes, it is.
All right. Jen, you had something else for the committee?
Yeah, I'm not sure. Can we ask questions of those who submitted public comment? Is that appropriate?
I don't know the logistics of that, but I think we'll maybe allow it and see how it goes.
I just wanted to make sure I understood Mr. Alvarado's requests or comments, if he would answer a question of mine.
Sure.
So are you saying, so this is the first time I've ever heard of a biblical counselor, so please forgive me ignorance.
No worries.
Are you saying that you would like this in addition to the existing like LCSW certifications? Or are you saying that you would like for us to work with insurers to acknowledge biblical counselors as a provider that they reimburse?
The latter.
Okay. I just wanted to make sure I was clear, because I could be wrong. Eric's the real expert, but I'm pretty sure the state, well, this subcommittee for sure doesn't have that jurisdiction. And it's kind of outside of our scope, but if you'd like to contact me offline, I'd be more than happy to chat more with you.
Yeah, absolutely. I just have had many people come seeking services and I have to turn them away because I can't take insurance. And they say they can't afford it. Yeah.
I understand. Thank you.
Mm-hmm.
All right. Any additional feedback or questions for staff or for anyone on the committee? Seeing none, the next meeting is scheduled for April 10th at 2 p.m. Again, that will be Zoom. So we'll meet again in this format. Looking forward to that conversation. Aaron, you'll work on a poll for us to provide some feedback on what we want to prioritize for that meeting potentially, and also maybe give us some proposals on what you think might be the appropriate construct for that meeting. Does that sound right?
Yes, I will work on a summary and some ideas for everybody, and I will hope to get that out to the group on Monday, and so you can take a look at that and respond to me within a couple days, and so we can get moving on the April 10th meeting.
Great. Seeing nothing else for the subcommittee, I will move us to adjournment. Thank you for your time and have a great weekend.
Thank you.
Thank you all.
Thanks all.